Let's talk about tanning. If you want to watch this video in Hindi, click the icon. Namaste. I'm Dr. Mansi, board certified dermatologist who knows how confusing Indian skin and skincare can be. So let's simplify it together. Today's topic is tanning. It is a concern that I get asked about possibly the most. So today we will cover why tanning happens, how to avoid it, and if you still get tan, what you can do about it. So let's begin. Why does tanning happen? Tanning happens because of exposure of your skin to UV rays. When UV rays come in contact with your skin, they cause an increase in the melanin. Melanin is what gives our skin its color. An increase in melanin is seen as tanning. Tanning means your skin has already been damaged, but tanning is a mechanism to prevent further skin damage. It's important to understand that some people, when exposed to UV rays, get burnt, while some get tanned. This depends on their Fitzpatrick skin type. Skin type 1 is more prone to sunburns and never gets tanned, whereas skin type 6 has more melanin, is more prone to tanning, and almost never gets sunburnt. Indians have a diverse skin type and fall between skin types 3, 4, and 5. So, what can we do to prevent tanning? Well, the most obvious answer is to avoid UV exposure. While that might not be practically possible for everyone, what you can do is avoid direct UV exposure between 10 a.m. to 4 p.m. If you have to venture outdoors, apart from wearing sunscreen, you must also go for other sun protection measures like wearing a hat, long sleeve clothing, UV protective sunglasses, and seeking shade wherever possible. If you are somebody who enjoys swimming, go either early in the morning or in the evening after sunset. You can also go for an indoor pool. One of the most effective ways to protect your skin against UV exposure and tanning is by using a sunscreen. But it is important to keep a few things in mind while choosing a sunscreen. First, it must have broad spectrum protection, meaning it should have UVA and UVB ray protection. If you are somebody with a lot of screen time, it is advisable that your sunscreen also contains blue light protecting filters. A minimum of SPF 30 PA3+, but if you can go for an SPF 50 PA4+, even better. SPF denotes UVB ray protection, whereas PA factor denotes UVA ray protection. Here are some of my picks for face and body sunscreen. If you are somebody who goes swimming or sweats a lot, it is advisable that your sunscreen is also additionally sweat and water resistant. And also giving you some recommendations for face sunscreens that are water resistant on the screen. Now, if after all of this you have still gotten tanned, what do we do? Firstly, before treating the skin, it is important to nourish it and let it repair itself a little bit. This is done by using a hydrating moisturizer. Use a moisturizer with additional soothing ingredients like calendula or oats. Here are some recommendations for nourishing body lotions. After your skin is tanned, it is irritated and dry. Therefore, nourishing it before treating it is extremely important. Otherwise, your skin can get further irritated. Along with nourishing and moisturizing your skin, remember to protect it by using a sunscreen to prevent further damage and tanning. When it comes to treatments, you can go for ingredients like glycolic acid or lactic acid, which will help exfoliate the upper layers of your skin, removing the pigmentation. You can also look for lotions with ingredients like kojic acid or arbutin, which will also help in decreasing further melanin production. I'm putting up a few recommendations on the screen. If you want quicker results, or if your tanning is very stubborn and not responding to these lotions, you can go for in-clinic procedures. Your dermatologist could offer you chemical peels with ingredients like glycolic acid, lactic acid, or even a yellow peel with retinoids, or give you prescription creams with ingredients like tretinoin or hydroquinone, which must be used under a dermatologist's supervision. Tretinoin and other retinoids will help to promote skin cell turnover, whereas hydroquinone will inhibit melanin production. Your dermatologist may also recommend lasers like Q-switched ND-YAG laser, which will target the melanin and break it down to help fade away the pigmentation. Both the peel and the laser will require multiple sessions, so it is important to stay consistent and also use a dedicated anti-tanning routine between these sessions. You can also use skincare with ingredients like vitamin C, vitamin E, which are antioxidants and will help to reduce the free radical damage caused by UV exposure. These antioxidants will not only help to brighten your skin but will also help in repairing your skin. I'm putting up a few recommendations on the screen. One thing to keep in mind is to not use harsh scrubs. A lot of people think that by scrubbing away the pigmentation, they could be reducing their tanning, but in fact, this can lead to frictional pigmentation and worsening of the tanning. That's all for today. Thank you for tuning in. If you found this video helpful, be sure to hit the thumbs up and the subscribe button. And if you have any topics you'd like me to cover, drop them in the comments, and I'll see you in the next video.